Well, hello, friends, and welcome to another WSIB Truth Matters with Joe Machado, where I separate the truth from bullshit, facts from fiction, in plain English. So we're into the second video in this whole series for November about the issue of mental health, how the WSIB is addressing mental health issues with respect to injured workers. And a lot of the flaws, and that's a nice word, that I see in the system. And I want to continue to speak about this issue because it's important. It's the most important right now. All right, my friends. So without any undue delay, let's get at it. And we're back to my friends down at the WSIB. My salute. But it doesn't really illustrate how much disdain I have for this organization and the people that work in it. You know, from a young age, our parents teach us about respect for yourself, respect for your parents, your elders, and to treat people in a nice way. And they teach us about compassion and about empathy and about standing up to bullies, because in this world, bullies are destructive. By nature, they don't have empathy. They're not sympathetic to anyone but themselves. And they are just destructive people. And unfortunately, through my experiences in dealing with the WSIB for over 35 years, or approaching 35 years, 1988 was my first office. I have seen an organization that is so rotten, but just rotten to the core. I've dealt with presidents who have come and gone, and VPs who have also come and gone, but some of the good ones are still there, and directors who have gone, but some of the good ones are still there. And I still have good relationships with these people, despite what the WSIB so-called leadership would think. And I think it's a bit of a conundrum for them. Because it's important to be in the know. And I also want to convey that there are people within that organization who still know the difference between right and wrong. You don't see that very often, but it does happen occasionally. But in over that time, going on 35 years, everything I've seen from this organization has been destructive. Destructive to the point where there's no trust in that organization. Every injured worker I talk to, and I get countless emails from individuals who watch my videos, and thank you for that, by the way, because I hope that in some way I'm helping you in dealing with this animal. The stories that I hear all the time, over and over, and it can be exhausting, but I hear them, and there's no sense of goodness, right? We all understand goodness. Children understand goodness, which is to want to help another human being rather than to fuck them over. And in private business, it's different. Insurance companies operate differently. Their standards, regulations are different. They don't have the government who supports them unconditionally, no matter how fucked up they are. And so I understand where insurance companies have this position or posture that they're going to deny. Then you have to get a lawyer and sue. And before you actually go before a judge, they agree to a settlement because they know that going before a judge is the absolute fucking worst for them. And I understand the games in that sphere, right, in private business. And of course, I understand also the need to be fiscally rich, because that's how the shareholders and everybody makes money off of it. But with a public organization like the WSIB, funded under the Ontario government through the mandatory contributions of employers, I don't understand how these people have to be so heartless. The people making decisions, how they're so fucking detached from that goodness that I speak of, that we all want to portray and convey as much as we can, and the example that we set for our children, right? These people, they're so fucking disconnected from that the decisions they make and the way their conduct is so disconnected. And I think that's the worst thing that could happen in a public organization, when it's lost its way. And this organization, oh yeah, it's lost its way for a long, long time. I'm talking about this because the mental health crisis with injured workers is imminent. It is the most urgent situation that needs to be addressed. Because the biggest and the most severe consequence of mental health issues not being addressed and a person not being supported is death by suicide. That's it. The finality of that is profound, because it doesn't matter anymore whether there's laws that could have prevented it, whether there's laws that could have made things better, whether there are laws that could make people accountable. It's done. Over. Finished. And sadly, this organization, in my view, has made that, through negligence, made that happen. That's inconceivable, that you have an organization that was set up to help injured workers in need, and yet fuck them over in such a horrific manner that they feel they have no other option but to finish and terminate their existence on this planet. It's appalling. Everybody should be horrified by this. No one should accept this as acceptable. And yet, it happens. They go on, they change programs and systems, and they use really nice, pretty terms. And when I'm talking about they, you know who I'm talking about, WSIB, right? I'm not afraid to say that. And they use these words, right? Because it's all words, to try to make things pretty and to try and emphasize or promote in this scheme of marketing and public relations that they actually care, but they don't give a fuck, right? They don't, right? But their newest thing is this new program that they've started. Well, they haven't started it yet, and of course I get to know things way ahead of time before they actually get into the public domain. But it's this new program. It's called the WSIB. It's called the Mental Health Program of Care. The Mental Health Program of Care. They're still in the I suppose the final stages of letting it sort of being introduced, and then of course they'll promote it and try to gain some public sympathy and support overall, to try and erase a lot of the bullshit and crap that they create themselves, right? But that's what happens in public relations. That's what people do. They don't like to face the challenges and head on and say, hey, listen, I have a way to fix this or to help. No, let's just call it something different, and maybe we will distract everybody from the real problem, right? But all it is, they have these specialty clinics, which they still do, and now they're reaching out to employers, to psychologists, psychiatrists, people involved in mental health treatment, and this sort of so-called program of care, and they're inviting mental health practitioners to enroll. And so I'll just read a little bit, and I'm not going to read too much more, because when I read it just makes me sick, because I just know it's shit. It's crap. Right, but anyway, that's my opinion. But so this is what they're saying. What you need to do, right? They say, well, as we shared earlier this month, because they have been having consultations with I don't know who, but obviously not injured workers. We're pleased to be expanding our program across mental health care providers who are delivering mental health care. And we know many of you are currently working with the WSIB and play a key part in helping people. And return to work following a workplace injury. Really? You may have to rewrite that, because you're not fucking doing it. And so what's happening? Well, they're saying, we have heard about what we can do better. They're listening. And what is working well since we developed our last program in 2018, which was their specialty clinics. We have identified opportunities to refresh and optimize the program. Opportunities to refresh and optimize the program. What the fuck does that mean? Like what, really? Opportunities to refresh and optimize the program structure to ensure mental health care is delivered even better. Faster, easier, by integrating all healthcare professionals into one program. Okay, so they've had their specialty clinics. You go down, you get assessed by them, then they make recommendations, some of which are to be treated by a professional in your community, a mental health professional. They're already all networked, right? It's not like you have to go and punch a fucking number somewhere to figure out where they are. They're not reinventing the wheel, right? And the mental health specialty clinics seem to have been working. I mean, I've read a lot of files, and I see their recommendations and how thorough they are and their reporting and all that. And in my view, it seems to be that they seem to be working somewhat. And then people get referred to treatment in their own communities. You've probably experienced this yourself. And we read those reports, and we read the reports between the treatment provider and the WSIB, and we look at all of it and say, wow, the mental health clinic said, yeah, this is good. This is the recommended treatment. This is the consistency of treatment, and so on and so forth. And they make recommendations about return to work and work reintegration services and all of that kind of stuff. And it seems to be working. But when the WSIB doesn't like that, they say, wow, we don't really we don't see any, what's the word? We've accepted with psychotraumatic disability and PTSD or mental stress or whatever the case, but we don't see that there's any restrictions. You can just go to work like you normally did. Like yesterday, before all this fucking shit happened, that caused you to really need help, right? From a psychologist or a psychiatrist, right? None of that. Forget about all that. Just go back to work. You're okay to go back to work. Like, on what fucking planet does that make any sense to anybody, right? But the systems, well, so now they're saying, well, let's create something different because we don't really, we think we can improve on it. So let's get other mental health providers in your communities and across the province. Let's get them all registered now individually, and we can kind of deal with them and yada yada yada, right? And so they have an application system. This is what they say, right? What you need to do. That's for the psychiatrist or the psychologist or therapist. You need to apply to deliver the new mental health program of care, even if you are delivering services today. Okay. So if I'm delivering services today and they're okay, why the fuck do I need to apply for another one? Anyway, this new program will replace the community mental health program, right? Oh yeah, the one that we kind of didn't like because we really couldn't control what they were saying. And we didn't like them saying that you weren't ready to go back to work because it goes against our, what is it? Oh yeah, budget reduction measures as opposed to trying to help you. So then they say sole practitioners, clinics, and new providers to WSIB are all encouraged to register, right? And then they say the new program can now be delivered by a network of professionals, including psychologists, psychological associates, psychotherapists, occupational therapists, and other regulated health professionals delivering the controlled act of psychotherapy. Holy fuck. So that got me thinking, could it be that all of these psychologists and psychological associates and psychotherapists and occupational therapists and other regulated health professionals like your doctor and delivering the controlled act of psychotherapy, so none of them were qualified to this point, right? Or the ones that are providing you with care and treatment, they're not qualified? Is that what they're saying? Holy fuck. What a statement. What the fuck are these people on? Every psychotherapist, psychologist, psychiatrist, therapist, your doctor, all of them are part of this environment. All of them are providing treatment. That's what they do. That's their role, right? That's the reason for being a doctor. They've already received their accreditation. In fact, despite what the WSIB says, they're providing you with treatment and advice that is based on their expertise and their training that you should listen to. Not these fucking quacks at the WSIB putting down a bunch of words on a program that they're launching. You see, this is what I come to realize. The WSIB is looking to remove the role of a doctor in the decision-making process, right? Everything I see that they do creates this sort of thinking in my own mind, and I'm sure in many others. But I can articulate it, and I don't give a fuck what they think. So that sort of gives me a little bit of freedom to separate the truth from bullshit, as you heard it in the introduction of the video. Because if they were willing and looking to understand and to be able to work with doctors to help in the recovery and return to work process, they wouldn't be playing this bullshit fucking minds. And the role of doctors wouldn't be so explicit in their own wording, in their own bullshit words on their website and all that. They would actually be following that. But let me just explain to you on their website how they refer to doctors and how vital healthcare professionals are in the administration of treatment and care as required or as stated in the Workplace Safety and Insurance Act, which is the law, which I'm going to get into that in a moment. But this is what it states, right? This is what it's, I'm going to put it up here, right? Treatment recommendations for a claim coming from the treatment provider, a healthcare provider, such as a physician, specialist, or psychologist. All recommendations are reviewed by the case manager and nurse consultant. Decisions on healthcare entitlements may involve gathering further information from the treating healthcare provider to discuss where the treatment is best delivered. The WSIB has access to high-quality providers and facilities across Ontario, many under contract, including public hospitals that deliver timely access to care. And then they have a list of the specialty programs that they have. Any care requiring inpatient services, such as surgery, addiction, or residential mental health programs, are all carefully reviewed and discussed with the case manager, nurse consultant, and primary health care provider. I call bullshit on that one. In making healthcare entitlement decisions, our commitment is to work with the primary healthcare provider to ensure that access to quality care that is safe and appropriate to a person's specific needs. Okay, so, all right, I'm sure that every single one of you right now watching this video are reading that and listening to me read it, and trust me, I had some challenges because I wanted to vomit most of the time. A lot of it is bullshit, right? So they say one thing but expect another. I mean, even just this week I had 2 directors, right? I'm not talking about a case manager. I'm talking about a director who's high up there, right? You know, say, well, we don't have a medical opinion that will go against the opinion of your psychologist or psychiatrist, but we believe that a thorough review of all of the information is sufficient to, to support our decision to stop your benefits and force you back to work, even though your doctors are saying you're not ready. Right? That's a contrast, right, to what they're saying. Now, here's another thing. They talk about the law and they talk about how important healthcare providers are. They're the most important factor in the administration of the insurance plan. Doctors are the most important factors because the doctors are the only ones that are medically qualified to determine whether or not whether it's physical impairments or psychological impairments, whether you're ready to return to work or participate in any return to work activities, right? Not case managers or directors or the fucking president, Jeff Lang. None of them are qualified to make those opinions, inform those opinions, and make those conclusions, right? Doctors are the most important ones because injuries are treated by doctors. Industrial diseases are treated by doctors, right? They're all treated by doctors. And to have a lay person, right, try to overrule doctors is simply asinine. It's ridiculous. That's why if you read the Workplace Safety and Insurance Act, which is a document about that thick, it's not very thick, their policies are about a 9-foot ceiling tall because they create policies, and anyway, a lot of them, they don't abide by them, but the word doctor or healthcare doctor is mentioned 47 times, exactly 47 times in the Workplace Safety and Insurance Act. And the Workplace Safety and Insurance Act is the law, right? It's the law that case managers, directors, VPs, CEO, CFO, the president, Jeff Lang, the chair, Grant Walsh, right? Their opinions don't mean shit. They're just lay people who move shit around and say words and make decisions. A lot of them aren't really within or in line with the recommendations of your doctors. But 47 times doctors is referred to in the Workplace Safety and Insurance Law, or Act, which is the law. And so why are they referenced? Well, they're referenced in sort of the medical examinations and reports. Workers are often required to be examined by a doctor to confirm the nature of their injury or illness. Makes sense, right? Because Jeff Lang can't confirm the nature of your injury or illness. No, he can't, right? Doctors can. That's why they're referenced 47 times in the Workplace Safety and Insurance Act. Okay, then, entitlement to benefits. A doctor's opinion is central to determining whether a worker qualifies for compensation. Of course, what you have is a condition that is either as a result of your injury or not at your workplace. And doctors don't report injuries and illnesses on the Form 8, which is the doctor's report of illness or injury. They don't do that unless they believe, based on their treatment of the injury, the etiology of the illness, and how it all happened, they report that to the WSIB. So without that, the WSIB, you could have a monkey sitting there saying, well, I don't know what this is from. I guess I'm just going to fucking deny it. Because the doctor hasn't told me one way or the other. And then in the return to work process, they're so important. Doctors provide medical restrictions and recommendations that guide modified duties or rehabilitation, right? Again, Jeff Lang can't do that. He's not qualified to do it. And neither are any of his minions and the minions below them. And all the way down to the fucking case manager, who oftentimes thinks that he or she are a doctor. And then lastly, doctors are important in resolving disputes. So in certain cases, the Act, the Workplace Safety and Insurance Act, the law, allows for independent medical examinations by doctors, right? To help clarify diagnosis, etiology, prognosis, all of these things, treatment, so that these idiots can make decisions. But they should use that information to make a decision, not to overrule it or oppose it. Because again, they're not fucking doctors. They're not qualified for it. When you need to go see your doctor because you're having a breathing problem, which could be, I don't know, a number of different things, but let's say, okay, pneumonia, right? You're not going to go down to the guy that changes your fucking oil on your vehicle or your fucking tires, right? That's not where you go for medical treatment and recommendation and when you feel that your health isn't as it should be. That's why the Workplace Safety and Insurance Act has written doctors and their role and purpose 47 times into the Workplace Safety and Insurance Act, right? If they didn't want doctors to be involved, they could have said a case manager has a final decision in any situation, and you have a right to appeal and go to a hearings officer, appeals officer, and then they can do their thing and disregard the law. They wouldn't have to have doctors written into the act, right? They wouldn't have to keep coming up with new programs and colorful words to mask the bullshit that's really going on, right? They call it like I see it, right? Facts from fiction. We don't live in a fantasy world. We don't live in a fantasy world. And as you can see, I'm very passionate today. And I'm pissed off. And I'm angry. And you're probably going, fuck. Most times I see you're pissed off and angry at these people. But I really am. And I'm sad too. Right? I listened to the last conversation of the member of a family who hired me, our company, to help them with addressing what they believe was negligence causing the suicide of their loved one. I heard the last conversation between that person who committed suicide and the case manager. After that conversation, the very next day, that person committed suicide. His 15-year-old son found him and was asked by the paramedics on 911 to cut him down. Imagine this happening to someone you love.